Are you at home worried about the potential effects of COVID on yourself, your family, your health? Well, the St. Mary's Cure production studio has prepared for you a series entitled Ministering to the Whole. The first episode will be a presentation done by Dr. Sandra Knight Reese on your health and COVID 19.
Welcome to this health presentation on COVID-19, an illness caused by the novel coronavirus, SARS-CoV-2. I am Dr. Sandra Knight Reese. We are currently in a pandemic of COVID-19 caused by a novel coronavirus. The SARS-CoV-2 is spread by respiratory droplets dispersed when we cough, sneeze, or talk, when we touch contaminated surfaces, then touch our eyes, nose, and mouth. The virus is also found in stool. However, the spread by stool has not yet been proven. There is currently no cure for this illness or vaccine, though over 60 trials are in progress. Treatment protocols are emerging, but is hinged on supportive care. So, prevention is better than cure. My focus today is on self-care and protection from COVID-19, home care of the COVID positive person, and dispelling the myths. Self-care and protection from COVID-19 is essentially about maintaining good health. Good health is a state of well-being, not just the absence of disease. Good health is wellness of the body, mind, social, and spiritual aspects of our being. Body. Some of us have pre existing conditions like hypertension, diabetes, asthma, sickle cell disease. Some are immunocompromised due to HIV or autoimmune conditions like lupus. Others have cancer, heart conditions, kidney disease, which put us at higher risk if we get COVID-19. Our aim is first to achieve good control of these conditions, take prescribed medications to achieve good baseline control and wellness. Then we further strengthen our immune system by eating a balanced diet inclusive of fruits and vegetables to get essential vitamins and minerals. Special emphasis on vitamin C rich foods like citrus, apples, pineapple, mangoes, cherries, grapes. We may also supplement our diet with vitamin C, 500 to 1000 milligrams daily, vitamin D3. Vitamin D deficiency is linked with reduced ability to fight COVID-19. We can get vitamin D naturally through sunlight by exposure of arms, legs, face for about 15 to 20 minutes per day, and supplement with a general multivitamin with zinc. We can also strengthen our immune system through exercise, which also improves lung fitness and boosts the mood through the release of feel-good hormones called endorphins. We can strengthen our immune system through adequate rest. Mind. This pandemic has come with one constant: change. We should acknowledge that this is an uncertain time that may cause fear, health anxiety, disbelief, hopelessness, frustration, depression. The stressors include the promotion of social isolation, job insecurity, being closed in with family, tensions, tempers rise, and abuse may also escalate. Increased demands with homeschool while at work. Work changes coupled with new expectations and demands. Psychiatrist Dr. Abel suggests that we name it, claim it, and tame it. Let us remain positive. In each change or stressor lies the opportunity to grow. Remember, The majority with this illness will survive. Once there is life, there is hope. There is now a move afoot to change the term social distancing to physical distancing, as social distancing implies social isolation and can cause some depression. It can occur if we don't stay connected. A word on a vulnerable group, seniors. Recently, Professor Denise Eldemire Scherer suggested that we remember that for seniors, a trip to church, to the pharmacy, to the doctor, picking up or caring for grandchildren, all present opportunities for social interaction, a lifeline. When their independence, the ability to take care of themselves, is taken away by quarantine, it can negatively affect their self-worth. Many are wilting in confinement. Those with dementia may be particularly challenged or become challenging, not understanding or remembering all the changes, the need to wear the mask, the increased hand washing, the need to stay inside. With all this in mind, Professor Eldemire Scherer recommended that it's important for seniors to establish routines, especially during this time of confinement. So, what can we do to care for and protect our mind? 1. Stay positive. 2. Stay connected. Call, reach out. Have a chat at your gate, 6 feet apart, wearing masks. 3. Choose to filter news media input with COVID. Reduce some of the negative conversations, especially those with gloom and doom about COVID. Seek to help to deliver groceries or medications to shut-ins. Be grateful for life. Find meaning in all tasks, even self-care, work. Be creative. Look for opportunities to grow, to do things differently and better. Use the opportunity to build relationships and to spend quality time with friends and relatives. Spiritual. Stay in touch with God. Offer personal prayers for self and others. Read the Word. Be comforted by the Word. Fellowship by means of church chat groups. Read and share daily meditations. Call and pray with a friend. All of this said before focusing on the external protection by means of sanitation. When we speak of sanitation, the first thing that comes to mind is hand washing. Soap and water is best, or the use of an alcohol-based sanitizer, one with greater than 65% alcohol. Wash hands for at least 20 seconds. Include the palms, between the fingers, the fingertips, the back of the hands, the thumb, and wrists up the forearm if exposed, especially if you lean up on public surfaces. Secondly, by sanitation, remember to clean and disinfect frequently touched surfaces like doorknobs, countertops, tables, light switches, toilets, faucets. Disinfect grocery packaging. Wash fruits and vegetables before packing away in your cupboard or refrigerator. Disinfect any item brought into your home. Pour contents of cooked food out of handled packaging to plate and discard the container. Heat or microwave for at least 30 seconds and wash hands before eating. When returning home, remove your shoes and spray with 70% alcohol or disinfectant the top and especially the bottom of your shoes. Remove outer clothes and place in a bag or clothes hamper prior to washing. Wash the bag and disinfect the hamper once emptied for washing into your wash tub or machine, and then wash your hands. When coming in, after stripping, go to the bathroom and wash your face, hands, and arms. If exposure was great, for example, if you went to a hospital or in a dense, crowded place or near persons sneezing or coughing, go and bathe and wash your hair. Practice good respiratory hygiene. Sneeze and cough in a tissue and discard it immediately. No rags, please. To retouch the rag is to reinfect. If no tissue is available, use your elbow and remember to sanitize or change your clothes thereafter. Remain a safe distance from those who are sick. And if you are sick, stay home.
Physical distancing means that you assume that you have COVID and that others have it also. As such, keep 2 meters or 6 feet away from others.
Wear a mask or facial covering primarily to protect those around you and also yourself. And tan a your yard. We move to the next part of the presentation, which is home care of someone infected with COVID-19. Symptoms of COVID usually appear 2 to 14 days after exposure to the novel coronavirus. The symptoms include fever, chills, cough, difficulty breathing, sore throat, runny nose, headache, loss of smell or taste, loss of appetite, nausea, diarrhea, fatigue, muscle pains. If you suspect that you have or someone you know has these symptoms, call the Ministry of Health and Wellness hotline 8881 Love. You may be directed to call your doctor for advice if they think that your risk is low for COVID. I'd like to spend some time on the mortality risk by age. Between ages 50 to 59, there is a 1.3% risk of death. Between the ages 60 to 69, it moves to 3.6% risk of death. By the time you get to 70 to 79, it almost doubles to 8%. And over 80, 14.8% risk of death, which is why seniors are under mandatory quarantine. It is important that each household formulate a care plan in the event that a member, especially the elderly living alone, gets sick. Care plans should pre-exist COVID, especially for seniors. First, make a list of medical conditions, prescription medications taken, emergency contacts. Include, if necessary, directives about end-of-life care options. For example, if you do not want to be put on a machine or you do not want to be kept in a vegetative state, indicate this. Also, put your business in order. Make a will. Now, directly about the home care of the COVID positive person. Ensure that you stock up on items required for the care of this patient. Ensure there is enough food. Get over-the-counter medications like the fever reducers, paracetamol, cetamol, acetaminophen, Tylenol. Same thing. Do not use ibuprofen or Advil, Cataflam, Aleve, aspirin, or Voltaren. These can make COVID worse. Get Vicks and cough medication with expectorant, compatible with hypertension or diabetes if the person is so affected. If asthmatic, ensure that the inhalers are available. Get disposables like tissue, gloves, and masks. Also consider getting disposable utensils, plates, cups if possible. If it's not possible, then wash plates, silverware, cups, or drinking glasses with gloves using disinfectant and wash in hot, soapy water. As much as possible, keep separate utensils for ill persons. The COVID patient needs to be self-isolated. Ensure that the patient gets lots of fluids and rest. Do not share utensils, electronics, bedding, cushions, or pillows. As much as possible, they're to stay in their own room using their own bathroom if possible. If the bathroom is shared, have it disinfected after use by the sick person if they're well enough so to do. If it is to be cleaned by a caregiver, wait a while before entering to clean and wear mask and gloves. If handling body fluids like urine, vomit, or stool, wear mask and gloves. Use paper towels instead of face towels. But if face towels have to be used and other towels, to launder towels and clothes, do not shake because you may aerosolize the virus. Use hot soapy water and the hot option on your dryer if using one. Disinfect your clothes hamper, then remove gloves and wash hands. Use lined garbage bags for waste or lined garbage cans for waste generated by the sick. Use gloves to remove the waste. If the ill person must enter common spaces in the home, he or she should wear a mask and stay only in well-ventilated spaces. A fan helps to remove droplets from rooms. Caregivers, do grocery shopping, source medications, pre-prepare and freeze meals, especially if the ill person is not resident in your home. Care for the pets and plants of the sick. Most persons will have a mild course, but have the numbers of the Ministry of Health and Wellness hotline at hand in case the person has a high fever unresponsive to fever reducers, if they have difficulty breathing, changes in responsiveness or confusion. These are signs that the person needs to seek medical care. Deterioration can be rapid. Call ahead to be directed to the appropriate facility. Have the person wear a mask if they're not having shortness of breath. So, it is most likely the COVID person is going to get better. These are the guidelines on how to end home isolation of the COVID positive patient. The CDC criteria for ending isolation varies with the category of person and the approach to care. A person with COVID-19 at home or in a non-hospital setting who will not be tested to assess if contagious must have no fever for 72 hours without a fever reducer and no cough or shortness of breath and at least 7 days since symptoms appeared. The person with COVID-19 at home or non-hospital setting who will be tested to determine if contagious must have no fever without the use of fever reducers and improvement of other symptoms and 2 negative tests 24 hours apart. A person with a positive test but no symptoms can end isolation if 7 days have passed since the first positive test and no symptoms have appeared since the test. However, 3 more days of physical distancing and face covering are recommended around others. Finally, we are going to use information from the WHO International COVID-19 website to dispel the myths associated with COVID-19. Viruses cannot be spread by 5G mobile networks. Many countries have no 5G networks and have lab certified and SARS-CoV-19 cases. COVID-19 spread is not reduced if you expose yourself to the sun, temperatures over 25 degrees Celsius or 77 degrees Fahrenheit, or have a hot bath. It can be transmitted in hot and humid climates. Conversely, exposing yourself to cold weather and snow cannot kill the coronavirus. You can recover from coronavirus. You will not have it for life. Being able to hold your breath for greater than 10 seconds without cough or discomfort does not mean that you are free from COVID-19 or other lung disease. Confirmation of COVID status is by a lab test. Drinking alcohol does not protect you against COVID. In fact, increased intake can increase risk of other health problems. The new coronavirus cannot be transmitted through mosquito bites like dengue, chikungunya, or Zika virus, but protect yourself nonetheless as these are endemic to our region. Ultraviolet lamps and hand dryers, the ones found in restrooms, do not sterilize the skin but can cause skin irritation. Spraying the body with alcohol or chlorine will not kill the virus that has already entered the body. Rinsing the nose with saline is used to alleviate congestion in colds, but will not prevent infection with the new coronavirus. While garlic is a healthy food with antibacterial properties, there is no evidence that ingesting it has protected persons using it in this current outbreak of the new coronavirus. And we'll end with, in summary, protect yourself by frequent hand washing. Keep your hands off your face, that is your eyes, nose, and mouth. Avoid close contact with others, especially those showing respiratory symptoms. Sanitize your space and things external to your home before entry. As much as is possible, stay at home. Let us choose to keep hopeful, grounded in our faith, and deliberate in caring for ourselves and others. Thank you.